Dr. Scott, Blue Apron is the leading meal kit delivery service in the U.S., and while many people know what they do, they don't know about the types of meals you can eat when you cook with Blue Apron. Like quick bucatini with broccoli and pecorino cheese and Italian-style shrimp and sweet pepper. With incredible ingredients and chef-designed recipes, Blue Apron lets you see what the power of food can do. You and I both do Blue Apron, and we love it.
Love it.
I've learned some crazy cooking techniques doing Blue Apron that I never knew before.
And used some new types of foods we would have never tried before. It's absolutely been a great learning experience.
And I'm an omnivore, and Dr. Scott is a pescatarian.
Correct.
So they
serves
have
all of our needs.
Meal plans for both of us.
Yep.
Blue Apron delivers fresh, pre-portioned ingredients and step-by-step recipes right to your door. They can be cooked in under 45 minutes, and the menu changes every week based on what's in season, what's designed by Blue Apron's in-house culinary team. They offer 12 new recipes each week, and customers can pick 2, 3, or 4 recipes based on what best fits their schedule. And it's high quality. They send only non-GMO ingredients and meat with no added hormones. They have a team of professional chefs putting in a lot of care into creating recipes each week, and I've been amazed. I don't think I've ever seen... that I can remember, I haven't seen the same one twice.
Nope. No.
And that's unlike some of the other services that are out there.
Yeah, great diversity, great flavors.
You know, Blue Apron is treating Weird Medicine listeners to $30 off your first order if you visit blueapron.com/medicine. Check out this week's menu and get $30 off at blueapron.com/medicine. Blue Apron, a better way to cook.
You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, yo, take a scalpel, do the vertebrae.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, with my little pal Dr. Scott, the traditional Chinese medical practitioner who keeps the alternative medicine wackos at bay. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POO-HEAD. If you're listening to us live, the number is 754-227-3647. That's 754-22-PENIS. Or my favorite, 754-BARE-NET. Follow us on Twitter at Weird Medicine, at Lady Diagnosis, who isn't here, and at DrScottWM. Visit our website at weirdmedicine.com for podcasts, medical news, and stuff you can buy. Or go to our merchandise store at cafepress.com/weirdmedicine and get a Bristol stool cup. That's all anybody ever buys.
Right.
So you can rate your fecal matter while you're sitting on the pot drinking a cup of coffee, which is horrendous. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. So somebody said, hey, they do a really good show, but number 301 really sucks.
Oh, no.
That was the one we did when we were drinking.
That's
so
right.
I guess that's, whatever. What are we going to say?
We were
celebrating our 300th.
Right.
We didn't celebrate on the 300th.
Yes, it was like an after kind of glow or a hangover, if you will.
We should have just not done it. But anyway, it's good to see you, old buddy. We're going to do a short one today, but we're promising to get back to doing medical talk. And as a matter of fact, we're going to clean up our act a little bit. for a reason I can't divulge right now, but it will all become clear later if this thing I'm talking about actually happens. So anyway, we have some phone calls. Let's take some.
Cool.
Uh-oh. We lost Ronnie B. Wait, what did you say, Ronnie B?
Number one thing, don't take advice from some asshole on the radio.
Wow, that is absolutely the fact, isn't it? Just no truer words have ever been said. Area code 619. You're on Weird Medicine.
What's up, Dr. Steve? How you doing?
Hey, man.
Hey, it's Mark in San Diego. I should listen to Ronnie B, but hey, I've been pumping loads in my girl all weekend. We're on vacation and won't be so till Wednesday. How late is too late for Plan B?
Ooh. Okay. Plan B. Let's see. Okay, now I'm gonna tell you what. I'm gonna look this shit up because I don't want to tell you wrong.
You don't want to screw this one up.
That's right.
This is important.
I thought you're the expert.
Well, dude.
Hey, 25 years ago, maybe.
No, well, go fuck yourself, Dr. Scott. I'm the expert, but I just want to make sure that what I'm telling you is correct.
Right.
So Plan B is the so-called morning after pill. It should be taken as soon as possible within 72 hours after unprotected sex. And the sooner it's taken, the better it works. And you got to take it as directed. So, like if it was yesterday at noon, then it is 5 p.m. on today. So that would be certainly within the 72 hours. So
damn. So if I got like 6 healthy batches in there since Friday, I'm in a bad spot.
Okay, so today's Sunday. So when was the first batch, as you so eloquently said, laid into your girlfriend's vagina? What time?
Probably 6 before we went out for the evening.
6 p.m.
Little pregame.
Okay,
yeah,
6 p.m.
Eastern.
So 6 p.m.
Cincinnati time. We were in Cincinnati.
Okay. That's a detail I didn't absolutely need, but it does make it more interesting. I can picture it better. Okay, so Friday at 6 to Saturday at 6 is 24 hours.
Yep.
And then Sunday at 6.
We're not there yet.
Is 48 hours. So you're within that 72-hour time frame.
You've got 52 minutes.
No, he has 72 hours. It's 48.
Oh, I thought this is 48 hours.
He's at 48 hours.
Okay. Oh, yeah. Well, you're good, man.
Yeah. Now, Plan B, when used as directed, is generally safe and effective. And it contains a hormone called levonorgestrel, and it's the same hormone that's used in a lot of birth control pills. After she takes this, assuming that she decides to take it, and that's her choice, of course, she may have a weird period next time. She could have some nausea, abdominal cramping, fatigue, headache, dizziness, breast tenderness, and vomiting. It's better if she doesn't smoke. Because
she's a raging alcoholic. So she has all that anyway.
Oh boy.
Oh, no.
Okay. Does she smoke too?
Yeah, I don't, but she does.
Okay. That's probably why she doesn't take birth control pills, because smoking and birth control pills.
No,
yeah, go ahead.
Because we're Catholic. That's why.
Oh. Well, so wait a minute. Okay, I'm not even going to get into that. I don't get how birth control doesn't work for Catholics, but Plan B does. That's I don't. But
bottom line is 78.
Yeah, bottom line is 72 hours.
72 hours. Yeah.
Yes, there's side effects. Read the side effects, and let us know how things go. And God, dude. God bless you. Six batches in 48 hours. That's
working.
Even when I was at my best, and that was, I can even pinpoint the year. I would try to get one woman over on Friday, one on Saturday, and try to get a
nooner on
extra
Sunday.
innings on Sunday. And I don't think I ever did 6. Well, no, I don't know. I came close to 6, but anyway, I'm impressed. I'm enjoying your life vicariously, and good luck.
That's why Trump's trying to build a wall, because us beaners can go, man.
Whatever, dude.
All right, Dr. Steve, love
man.
the show, brother.
All right, love you too,
Hey,
man.
take
And
care.
thanks. Well, he didn't say he loved me. He said he loved the show. Okay,
That's
well,
right.
anyway.
Love you on Love you on Stern, too.
The one time. I'll never live that shit down. That was on my bucket list, though. It was awesome. Thanks, man. I'll talk to you soon.
Hey, good luck, dude.
So
Cincinnati, my favorite bar is up there, the Hofbrauhaus. It's an old
really?
German style brew house, and it's big, huge German kind of picnic tables and just the beer and the music and
big giant
the steins
of
my
beer.
God, it's like being at home. It's wonderful.
Big titted women and
Oh my
bodices
God!
and
Yeah,
stuff.
with big paddles. Like if it's somebody's birthday,
And they'll paddle them.
yeah, let's say that you and I,
Yeah.
it's your birthday, and there's 6 or 7 of us go. They'll have a big paddle with holes for shots of beer in it, and they put it down the middle of the table, and everybody grabs one of the beers out of the paddle, and you sell this singer or whatever, and then you get paddled because you're the birthday boy with that paddle.
Oh, and
it's good stuff.
there's nothing worse than getting paddled with a paddle that's got holes cut in it.
Right.
Because
A little more aerodynamically.
that's right. It can go
Sound.
faster,
Right.
and the air rushes through it so that there's no cushion from that compressed air that you would have if you had a paddle that
And you can
didn't
hear
have holes
you can
cut
hear
in
it whistling as it's coming
Oh,
at you too.
geez. That doesn't sound like fun. You're paying for that?
I like it.
All right, let's take another call. Well, all right.
Here that arose after a night of drinking too many
That's
Miller
my
Lights.
fault. Okay, let's try that again.
Hey, Dr. Steve. I'm just calling from Buffalo, New York. I have a question here that arose after a night of drinking too many Miller Lights. Say someone had like a heart attack and you didn't have a defibrillator. Could you use, theoretically, I know you're not obviously going to ever recommend this, but could you theoretically use a stun gun to start their heart, or is it just something that it's not strong enough or concentrated enough or anything like that?
No, you're just adding insult to injury. You've got somebody that's, dying in front of you, and then you're hitting them with a stun gun.
It's just going to hurt like a MFer.
My understanding is stun guns are alternating current, and a cardiac defibrillator is direct current. So I don't
Right.
think that's going to work. You can
I think that's why they designed it like that, isn't it?
it's so that it wouldn't do that.
Right. I mean, that's.
That may be.
I mean, I think so. I think that's. What
Oh,
I
that may be,
understand.
Dr. Scott.
I think
I'm
so.
going to give you one of these.
That's my understanding.
a bill.
I don't know that that's true, but it sounds true
Sounds right,
as hell.
Yeah.
So, yeah. You can do a cardiac thump, and the cardiac thump is where you take your hand and put it, several inches above the chest, and then just let it drop. The way they do it in the movies, where they're pounding on the person and breathe, damn you. That's not going to really do anything but just contuse their chest.
Right.
But if you hold your hand up and just let it drop and onto their chest, it actually stimulates electrical activity in the heart and may actually start it back up again if it was right on the bridge between, starting and not starting. So, okay, so don't do that.
No,
All right.
but it's a good question, though.
Yeah.
Good afternoon, Dr. Steve. I was wanting to know if you had some information about what I've heard to be a new fountain of youth drug by the name of Cimarron. Anyway, thanks. I'll listen on.
Okay. Well, Cimarron is a growth hormone releasing factor, basically. So you have human growth hormone. You can take that. And I'm not saying two, I'm just saying you could, or you could take a growth hormone releasing factor that would cause your body to produce more human growth hormone. It's still the same human growth hormone. So basically, Cimarron is just another way to increase human growth hormone levels in the bloodstream. And I know that it's been touted as a fountain of youth, and believe me, at 62, I'm looking for a freaking fountain of youth. But the extensive amount of study that I've done on human growth hormone supplementation in elderly individuals shows that it really does have an effect on healing. So if you're injured, human growth hormone may help. But other than that, I don't see anything magical. There's other ways that you can stimulate human growth hormone release, though. There's this supplement that you can take over the counter called GABA. It's gamma-aminobutyric acid. And GABA is a neurotransmitter that in the central nervous system will cause lots of different effects, including in certain parts of the brain, sleep. So when you take certain medications that are sleep medications, they increase the release of GABA in the central nervous system. Now, but taking GABA won't do that. You think, well, I'll just take GABA then. It doesn't work. It doesn't cross the blood-brain barrier. But the weird thing is that the byproducts of GABA, when they're taken at night, do seem to increase the production of human growth hormone. Another thing that may increase the production of human growth hormone is taking glutamine, which is an amino acid, after exercise. And so the first thing is, though, you got to exercise. So get some exercise and follow it with some glutamine, and then take GABA at bedtime, and you'll should increase your human growth hormone levels. So at least according to a couple of these really small studies that I've looked at in the medical literature. But I'm not a fan of just supplementing human growth hormone. If you overdose on human growth hormone, you will get a condition called acromegaly. And if you want to see what acromegaly looks like, look at Richard Keel, a.k.a. Jaws, from the James Bond movies. I believe, and if I'm incorrect, I apologize to Richard Keel, but I believe he suffered from acromegaly. Also, the British neighbor on the Jeffersons also suffered from acromegaly. So you get a big chin, you get this kind of weird throaty voice, you get pain in your joints, and it's just because the bones are trying to grow, but there's no growth plate. So they're trying to grow, but there's no place to grow into, so they just grow abnormally. And it causes sweating and a bunch of other stuff too. So not a fan. And I don't know enough about the Samoralin. I'm sure that people are supplementing in gyms and stuff like that. And again, not a fan of self-treatment with this type of prescription medication. I just can't endorse it. Sorry. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Let's see what we got here. Well, goodness. It's very
Hi, Dr.
professional.
Steve. My name is Peter. So my wife got into the essential oil movement, and I'm not sure, but she claims that a lot of this stuff has medicinal purposes, and it could prevent illness or help ease any kind of pain or help you heal quicker, and I really just don't know. And I'm wondering if you knew anything about it, or Dr. Scott. I just trying to find out if this is not bullshit or if there actually is a thing to them. Anyways, thank you very much. Love the show.
Okay, hey, thanks, man. Let's talk a little bit about essential oils in their use in aromatherapy. things like lavender are touted as causing, when they're smelled or inhaled, causing a peaceful feeling or decreasing stress. And a lot of this comes from the fact that the nerves that that come from the nose that affect smell or that sense smell are really at the top of the list as far as things being plugged into the brain. And so our sense of smell, although not very acute compared to other animals like dogs and other animals that rely on their sense of smell, is really tied into memory. And I know there are certain smells that I smell that it just immediately takes me back to my grandmother's house.
Yes.
And if I walk in the hospital, I smell that smell when I was an intern, and I immediately get tired. So aromatherapy absolutely
can work either way.
Does do stuff.
Yes.
It does stuff.
Yeah.
But I think this idea that lavender on everyone is going to make them feel peaceful is bullshit.
No.
What if you were, ritually abused by your grandmother and
her house smelled like lavender?
Her house smelled like lavender. When you smell it, you're going to feel anything but calm and peaceful. So I think that you can use these oils and find the things that work for you. If something makes you feel peaceful, great. Just don't generalize it to the rest of the populace.
Mm-hmm.
And, if your mom brewed tea every morning, using a little tea tree oil, something like that might make you think of your youth. If you had a very pleasant youth, then that might make you feel better. To make a generalizable statement about these smells, to me, is malarkey. I don't see any evidence in the medical literature. And then they didn't just talk about that. They went beyond that, talking about preventing disease and treating disease and treating pain. All I can say is show me your evidence. I just want to see the evidence. Show me one decent double-blind placebo-controlled study, and I know it's going to be hard to double-blind an aroma study, but do the best you can, that shows that you've prevented any disease, that you've cured any disease, or that you have relieved anyone's pain. What were you going to say?
Well, I was going to say, they don't only use them as aromatherapies.
Well, they rub them in, and
right. Well, and they do drops and they do topicals for certain skin infections and things like that. Yeah.
No, that's what I'm saying.
Yeah. Not just aromatherapy.
I was talking about the aromatherapy as something I can get behind.
Right.
Show me the evidence on any of this other bullshit.
Yes.
And I just want to see the evidence. When I see it, I will accept it. For example, there's good evidence. Well, it's decent evidence that tea tree oil used on fungus-infected nails will improve the way they look and may clear the fungus if used every day, twice a day for 48 weeks. The funny thing is that there's also evidence that shows the exact same thing for Vicks VapoRub. 48 weeks, twice a day, eradicates the fungus. Interestingly, there is a medication on the market called, Jublia or something like that. That is a topical antifungal that you paint on the nails, and you use it for 48 weeks. And you can get it with a prescription. At least it doesn't stink like tea tree oil or Vicks VapoRub. But they all seem to take about 48 weeks to do their thing. So, but anyway.
Well, but the one thing we do know is that there's been some pretty good studies on the peppermint oil, which is an essential oil, in those enteric-coated capsules.
Sure.
For irritable bowel.
Okay, I'll take that one.
So at least but some of the claims that I've heard, some of these.
Well,
people,
let's back up. So people are going, "What the fuck are you talking about?" So peppermint oil, there is some decent data that shows that enteric-coated peppermint oil improves symptoms of
in a capsule, not rubbed on your stomach or not sniffed, but actually taken in an enteric-coated capsule. Yes,
right. In the doses that they studied, improves the symptoms of irritable bowel syndrome.
And I will say, anecdotally, of course, it worked for me.
Sure.
Extremely well, yeah. Nothing else had worked. So
we've had a bunch of people report that. Again, that's anecdotal evidence, but they do have some double-blind, placebo-controlled evidence on peppermint oil. You can do that if you're ingesting it.
Absolutely.
So there may be other things. That's why I'm saying we recommend
studies.
that stuff. It's on our website. Go to stuff.drsteve.com, and I recommend you do that anyway, and thank you for doing that. Stuff.drsteve.com, and scroll down, and there's a link to that peppermint oil preparation. We don't. Boy, that was gross. Sorry,
but before we make any, broad-based, generalizable recommendations, there needs to be more studies.
Right. Well, any studies,
anything.
They make these outlandish claims.
Oh, I know.
And then let's see the evidence. How do we know stuff? We got to have evidence to know things.
Right.
You give 1,000 people your medication. You give 1,000 people something that looks and tastes just like it, but is inactive. That's the placebo-controlled group. And then you don't know which of those 1,000 people is getting the real drug and which is getting the placebo, and they don't know either. That's called double-blind, placebo-controlled. And then at the end, you have to have an endpoint. What's your endpoint? Well, you know what's weird is if you did a study on sildenafil, which is the active ingredient in Viagra, and your endpoint was blood pressure reduction, it didn't work that good.
Right.
So you got to choose your endpoint right.
Sure.
If your endpoint is big, meaty erections, it worked great.
Mm-hmm.
So you have to choose your endpoint, and then you have to see if there's a statistically significant difference between the active group and the placebo group. And if there is, then you can make a claim based on the characteristics of your 1,000-person cohort on either side. If they were all Northern European males, then you can really only say that it worked, for Northern European males until you test it in other groups that are slightly more diverse. So, that's how we know stuff.
Right.
And just saying, we've talked about this before. We had this Whole Foods pharmacy not too far from us, and they were selling the idea that since walnuts look like brains when you open them up, that they were good for your memory. And it's like, come on, what's the evidence? Well, it looks like a brain. That was their evidence. So I would consider that to be insufficient evidence. All right. All right.
Next.
Hey, Dr. Steve. I was just curious. My girlfriend gets really serious migraines, and this week she actually had migraines that got extremely worse. It's perpetuated over several days, and at first it was really severe. Generally she'll get migraines, and right before her migraines she'll start to have sort of minor loss of vision right before a really serious one, and she's been prescribed medication and had various tests done, and nothing's really shown up, and they've told her that it was serious migraines. Just curious if there's anything that I should look out for, or any way that I could possibly help her with this.
Yeah, the first presentation, particularly of migraines, can be really scary. I've seen 17-year-olds with left arm numbness and weakness, and weird neon sign visions in the side of their
periphery,
their peripheral vision, and all kinds of stuff like that. So those are called classic migraines when you have what's called an aura that goes with it. You start seeing flashing lights or smell weird smells or anything like that, and then you get the headache. And what's going on is you're getting a contraction, or this is presumed, by the way, you're getting a contraction of blood vessels in the brain and around the brain. And when that happens, when you get the constriction of those blood vessels, the brain isn't getting the blood flow that it's used to. So there will be weird effects sometimes, and loss of vision or weird vision or something like that, or tunnel vision even. May be something that you would experience. Then that goes away, and as the vessel relaxes, it over-relaxes because it's been contracting, and now it's tired, and so now it dilates. And as it dilates, it's going to start pumping, with the with the blood flow coming from the heart. And you'll feel this pounding feeling as those blood vessels feel like they're being stretched to the point of breaking. And there are these stretch receptors on those blood vessels, and it's a warning that they think that they're getting ready, they're tearing, right? And that's what those signals are for. And so it's just a very maladapted response to constriction of the blood vessels. And why it happens, nobody knows. It's probably genetic predisposition. There may be some environmental factors that lead into that. But so one of the medications that they'll use is something like Imitrex, which tries to continue the vasoconstriction, and then release it more gradually so that the vessel doesn't expand and feel like it's tearing. There are other medications that try to prevent the vasoconstriction in the first place. That's for people who are taking migraines more frequently than once or twice a month. And they need to take something every day. So they may take some vasodilators that just keep the vessels dilated, and the hell with it, they can't constrict. And then if they can't constrict, you can't get a migraine. Those are like calcium channel blockers and other things like that. Then there are the weird ones like Depakote, and which we use as a mood stabilizer, but it has some effects in preventing migraines. And there are other medications. I don't want to throw them all out here. I could, but it doesn't make any sense. There's not going to be a test afterward, and it's just going to sound like a bunch of gobbledygook if you're not used to hearing these drug names. So what I recommend is you go see a neurologist, and go see a neurologist that specializes in migraines. And if you don't have one in your area, you could go to a university center or Mayo Clinic or Cleveland Clinic or one of those diagnostic centers and try to get on a regimen. And what they'll do is they'll do a workup. They'll make recommendations. If it works, they'll refer you back to your primary care and just say, this is what we recommend. So I do highly recommend that she get checked. And the first time you have one of these, you need to get checked.
Absolutely.
Anyway. Okay.
Yeah, and real quick, can I add this too, Dr. Steve? Yeah, once everything's been cleared, and we know we know there's nothing.
Dr. Scott's got some
nothing that's profoundly wrong with the individual. Acupuncture treatments have been pretty effective for migraine headaches, stress-induced headaches, hormone-induced migraine headaches. And if the way we treat our people is usually once a month. It just keeps those headaches from coming back too frequently.
Yeah.
Now, this is in our office. I can't tell you there's been great research. I mean, I can look it up.
I think there is.
But if he
Actually,
has
there
not,
is some. Let's go ahead. Keep going.
If they've not found anyone, if they'll email us, we can certainly turn them on to someone in their area that is board certified in Oriental medicine that can do all the acupuncture and all the. Just making sure that she is well taken care of, because those migraine headaches. I tell people all the time, migraine headaches are the thing I hate to see the most because they're so debilitating for the person.
Right.
But for me, it's the most gratifying thing I see because it's
you help them.
It's the first. They get the quickest response. Yeah.
Here's a review article in the journal Headache. This is not some complimentary or alternative medicine journal. This is the journal of record regarding headache treatment, and it's just called Headache. And this is from 2015. And they reviewed large and well-designed trials of acupuncture for migraine prevention and also the effectiveness of acupuncture when tried against proven migraine preventative medications. And they concluded acupuncture seems to be at least as effective as conventional drug preventative therapy for migraine and is safe, long-lasting, and cost-effective. It is a complex intervention that may prompt lifestyle changes that could be valuable in patients' recovery. So I'm glad you brought that up. I mean, I've got an acupuncturist sitting here, and then I forgot to go to you on one of the things that there's really good data for what you guys do.
Right.
So, and I always recommend don't go to a weekend warrior acupuncturist. Find someone with a DOM after their name. That means they're a diploma in Oriental medicine. And they've done 4-year Chinese medical school. And those are the people that really know their shit about this stuff.
Right.
It's not to say that a weekend warrior couldn't learn how to do some headache
some good stuff.
But
yeah. But
still,
the main key is just making sure the person's healthy.
Yep.
Yeah. Work them up.
Yeah, Topamax. I've had really good,
Sure.
or Topiramate, had good luck with that. But I think every chronic migraine sufferer should see a good acupuncturist.
Absolutely.
I really do.
Yep.
All right. Let's do one more. Okay.
Hey, Dr. Steve and the gang. It's Tony up in Cleveland, and so my girlfriend and I, we get intimate and we enjoy ourselves and everything. And I got done,
braggart,
taking the plunge. And she said, "Can you do me a favor?" I'm like, "Yeah, what's up?" And she said, if there's an odor down there, can you please let me know?" And I'm like, "Odor? What do you mean?" She said, "Well, a few years ago, I had some cancer cells that were there, and they needed to be taken out. And apparently, the last time that happened, there was a mild, just very strong odor that was emitting from my vagina." So I guess my first question is, if she has, why would there be an odor there if there were cancer cells? And I guess the second one is maybe not necessarily a question, but what if I'm down there and I say it smells and there is no cancer? And I'd be in the doghouse. So love to hear that, and love the show. And thanks, guys. Thanks, Dr. Steve.
Thanks, man. No, it's a great question. So this woman had a weird odor, and she subsequently was found to have cervical cancer.
Mm-hmm.
So let's talk about how cervical cancer is caused generally by human papillomavirus, and certain varieties, particularly HPV subtype 16. And so cervical cancer is maybe, at least in its underpinnings, a communicable disease. Well, it is a communicable disease, and it can be prevented by vaccinating our kids against those virulent subtypes. But anyway, so when you have cancer, you get these cells, and they're not growing right. They just grow crazy. And if you look at them under the microscope, even an untrained eye can a lot of times tell cancer cells from normal cells because they look all wacky. The nuclei are all goofy looking, and they've got more or less cytoplasm than normal, and it's just in sort of random,
not normal shapes,
sheets
shapes
of just weird looking cells. Well, anyway, the tumors a lot of times don't have good blood supply, and they'll try to recruit blood supply to themselves, but even that's wacky, and so the cells will die off quicker, even as they're growing faster. They don't die off fast enough, unfortunately. That would be great if they did. And so that may be what was going on. She may have had some what we call necrosis of tumor cells that were just dying and then sloughing off, and then she had all these cells in there, and the body's got to do something with them, and and that will cause an odor. And those cells can also be food for yeast and bacteria and stuff too. So that's most likely what was going on. And you got to be careful. You get down there and go, "Honey, I think you got cervical cancer again." And she goes running to the OBGYN. You've just said she's got a stanky vagina.
Uh-oh. That's going to be painful.
And there's no cancer there.
No,
now I've heard of cancer sniffing dogs and stuff, and that may be some of this. Their noses are just so much more attuned to their environment than ours are. Well, anyway, all right. Well, let's get out of here. I'm about half-assed today. Don't forget, check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And don't forget, tweakedaudio.com, offer code FLUID. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.